instructions. So here we can go to the slide, and I'll share the screen. And so, do you see the slide? Can you see the slide?
Now, yes.
Okay. Well, so if we continue speaking about patient care, there is a question: why do you need to do these things before you carry out a procedure? So Amar is joining us. Well, the first is obtain consent from the patient for the procedure. Consent means agreement that the patient knows what is going to, what the medical practitioner is going to do with him, what kind of procedure it is. So why is it important to obtain his consent? Who can comment on this? Abdelrahman? Okay.
I think it helps establish trust between the patient and the doctor.
Okay. Good. Anurin, can you add anything?
Also, it's out of respect to introduce yourself first when we meet someone for the first time, and also some patient asks for a specific doctor. So when the doctor meets the patient, he has to say his name so that the patient will make sure that he is a specific doctor that he wants him to examine the patient, him.
Okay. Great. And why is it important to prepare the trolley? So you can see the trolley here in the picture. So why is it important?
So he wouldn't waste time looking for the equipments. So when he examines the patient, all things are near him, and he would finish the examination quickly, and nothing cuts him while examining the patient. Nothing interferes with him.
Yes, all the equipment should be prepared, and so the doctor should access it easily. And well, great, thank you. And if we move to the next slide, we can see here some instructions for a procedure. Mohammed Ali is joining us. Okay. Well, so here in this task, we should complete the the steps that describe a procedure, and you can see that we should use some words. They are given so in different colors. We should use them in the sentences. The words are prepare, mark, attach, wash, sterilize, drain, obtain, withdraw. I think all of them are easy to understand. Maybe withdraw means to get something, to take something away, take away something, yeah, like this. And you can also see some pictures that illustrate the words that are mentioned on this slide. And there are definitions for some of the abbreviations. For example, in line B, you can see 10 drops of CSF. CSF stands for cerebrospinal fluid here. And in line C, you can see the point between L 3/4 So L, lumbar vertebra. And yes, as for the pictures here, you can see the needles and the tubes, specimen tubes here, and then this is a manometer. Yes, here in the picture. Well, let us think of the possible words in each of the line. So in line E, Amar, what is the best verb to use here?
Line E.
Sorry?
Line E.
Line A.
Line A.
Yes.
I'm not sure, but I think it's withdraw.
So
Withdraw.
withdraw the stylet. Okay, stylet here is a catheter or tube, which is used to for some kind of liquid. So you think it's withdraw the stylet. So you start
No,
with withdrawing.
sterilize.
Yes? Sterilize.
Sterilize.
The stylet also possible. What are the other possible verbs to be used here?
No, I think that's
Uh-huh.
sterilize. It can't be washed or drained. Can't.
Yes. Can we say prepare the stylet?
Yeah. You
Yes,
can, yeah.
sure. Yes. Mhm. Actually, this is one of the steps of the procedure. So we'll understand which verb is better to use later when we go through all the other steps of the procedure. Okay, Anurin, what do you think of line B? So which verb is better to use here?
Prepare 10 drops
Sorry,
of
I missed it. What?
prepare.
Prepare 10
Prepare.
drops. Prepare
Yes.
10 drops. Well, okay. Is it the only possible just version here? Prepare 10 drops. 10 drops. Well, so CSF stands for cerebrospinal fluid. Cerebrospinal fluid, where can we get this fluid from? Is it a medication or what is it?
Maybe it's something injected into the patient.
Actually, cerebrospinal fluid is some kind of a liquid that inside the body. And this is the procedure which can, how can we get this liquid out of the patient's body? This is some kind of test to test this liquid. And
Then it's
uh-huh.
it's withdraw
Okay, can we
or prepare.
Prepare, withdraw, or
Yes.
if we use some tubes,
Obtain.
sorry,
Obtain.
obtain also possible. And there is one specific verb here, just which can also be used like drain. Yes, drain 10 drops. So is also possible. Okay, so Isar, what about line C?
C. I guess it is mark.
Mark the point between vertebra 3 or 4 where the needle is to be inserted. Okay, so we need to mark this. Well, Abu Ali, please. The next.
Yes, doctor. Your hand and put on sterile gloves. Wash or sterilize.
Yes, exactly. You're right. Okay, then Mohammed Ali.
Yes, doctor.
Line E.
Consent for the proceed.
Yes, this is patient's consent. Patient's
Mark consent.
Sorry,
Mark,
mark consent. Emma, what do you think?
Number E, it's obtain.
Obtain consent, sure. Yes, you should get consent from the patient. Okay, so Noha, please. The next.
Okay, the area of the patient's back.
Mhm.
Back, sterilize.
Exactly, yes, we've marked the place, the point, and now we should sterilize the patient back
Yes.
where we are going to apply some instrument. Okay, Rufaida, please.
Prepare the equipment on the trolley.
Exactly, yes, and Tariq. Tariq, hello?
Yes. Attach the manometer.
Attach the manometer and let us check whether we were right. So yes, actually here are the correct versions. Here, withdraw the stylet, drain 10 drops of the fluid into the 3 specimen tubes, mark the point, wash your hands, obtain consent for the procedure from the patient, sterilize the area, prepare the equipment on the trolley and attach the manometer. And you can see that these steps are mixed. Can we write the steps in the correct order? So what is the first step? If we just give instructions to another person how to do this procedure, what is the first step? What should we do first?
Wash your hands.
Wash your hands. Okay, so wash your hands, good. Then number 2.
Prepare the equipment.
Okay, then
Sterilize the area of the patient back.
before we sterilize the area and we need to get the agreement of the patient's agreement. So what is it? Obtain consent for the procedure. Okay, then do we know which area to sterilize?
So mark the point.
Yes, we should mark the point between mark the point on the back of the patient, and then maybe we can sterilize the patient's back. Then what happens next? Yes, hello. So after we yes.
Withdraw the stylet.
Sorry.
Withdraw the stylet.
Withdraw when we withdraw the stylet at the end of the procedure. But first we should do what?
Attach the manometer.
Okay, and we should also
Drain 10 drops.
Exactly, drain 10 drops of liquid, and then we should withdraw the stylet. Yes, these are possible. This is possible succession of steps that should be done during this procedure. And what kind of procedure is described here? What do you think? The instructions to what kind of procedure?
For a puncture.
Puncture, exactly, you are right, yes. So, and if we move to the next slide, this is the picture that illustrates these instructions, and this is a lumbar puncture. This is a procedure of taking fluid from the spine in the lower back through a hollow needle. usually done for diagnostic purposes, a spinal tap. Mhm. This is, you can see here where the needle goes, and the posture of the patient during this procedure. Well, I guess, yes, that is all just, I just wanted to say, to discuss today. And before we start doing the test, I would like you to revise something, some terms and phrases. In order to do this, I prepared the presentation, which is called the medical term maze. And if we are lucky, we'll see it. So it takes time. Well, and so there are some questions that will help us to revise and prepare better to the test. And it's done in the form of the game. Well, so let's go there to the full screen mode. So it, well, can you hear the slide? Can you see the slide on the screen?
Yes, doctor.
So this is a welcome to the question maze. And if we move, so our aim is to go through the maze and to get to the center of the maze, and we'll see something in the center of the maze. And we should choose the correct answer to the question to go the right way. If you make a mistake, you might get lost. Now let us answer the questions. So there are two options. As you can see, you should turn left or turn right.
The slide is in the first slide. It's not moving.
Not moving.
Yes, doctor.
Well, so we can do it like one more time. So like here.
Yes, right now.
Okay, good. And if we move, and we move, so yes, now the question. Can you see the slide with two options? Turn left, turn
Yes,
right.
doctor.
So the question, which medical job involves implementing standard politics and procedures that keep the practice running smoothly? So these people, they supervise the facilities office staff, hire and train new staff members, and manage finances and budget organizations. So, yes, Amar, what do you choose?
I guess it's practice manager.
Okay, let's check it. Practice manager, we should turn left. What happens if we turn left? Yes, you're right. Okay, the next question. This is a person who greets and deals with clients and visitors to a surgery office, etc. Yes, Abdulrahman.
Receptionist.
Receptionist. Let's check and go turn left. Yes, right. So the next, this is the person, this is a doctor who treats patients and who treats patients with minor and chronic illnesses and refers those with serious conditions to a hospital. Is a general practitioner or midwife? Yes, Emma?
General practitioner.
Yes, general practitioner. Yes, you're right. The next is, this is a nurse who visits people in their homes to assist or advise the chronically ill or parents with very young children. Is it practice nurse or health visitor? Amar?
Health visitor.
Health visitor. Okay. This is a person, typically a woman, who is trained to assist women in childbirth. Okay, let's listen to, yes, Abdelrahman.
Midwife.
Midwife. Midwife. If we go straight ahead. Yes, you are right. The next is, this is a nurse who visits and treats patients in their homes, operating in specific area or in association with a particular health center. Practice nurse or district nurse? So, Amar,
District
please?
nurse.
District nurse. Okay, if we check it, district nurse. Yes, you're right. And this is a registered nurse based at a general practitioner surgery office practice who works with the general practitioners to care for the patients seen at the surgery. There are three options: district nurse, straight ahead, general practitioner, turn left, or practice nurse, turn right.
Practice.
Practice nurse. Yes, you're right. Okay, and now about some other terms, like this is a chronologically written account of a patient's examination and treatment that includes the patient's medical history and complaints, the results of diagnostic tests and procedures. So, Abdelrahman, please.
Patient records.
Okay, let's check patient records. Yes, you're right. Now, this is the list and description of the health problems and issues experienced by the patient, resulting in the attendance. The list of the health
Patient's record.
patient's record. Okay. Ta-dam. No. We should go back at the beginning and just start with the first slide. Medical jobs. Medical job involves implementing standard policies and procedures. What did we choose first?
Practice manager.
Practice manager. Wait, sorry. No, I didn't. I'm sorry. Practice manager, of course. Yeah. Person who greets and deals with clients.
Receptionist.
Mhm. A doctor who treats patients with minor chronic illnesses.
General practitioner.
Okay, so this is a trained nurse who visits people at their homes.
Health
Health
visitor.
visitor.
Health visitor, right? A person, typically a woman who to assist women in childbirth.
Midwife.
Mhm. A nurse who visits and treats patients in their homes, operating specific area.
District nurse.
Nurse. Registered nurse based at the general practitioner's
Practice. Practice nurse.
Chronologically written account of patient's examination.
Patient's record.
Patient records. List description of health problems and issues. It's not
Presenting complaints.
presenting complaints. Yes. Which condition do you associate with the sharp pain at the right side of the stomach? Is it appendicitis, tension, a headache, or angina pectoris? Sharp pain, appendicitis. Right. Which condition refers to pain that radiates along the path of the nerve, which branches from your lower back through your hips and buttocks and down each leg? Is it ureteric colic or sciatica? Your choice. Should we go left or right? So
Maybe that.
maybe left. So ureteric colic, and look, this is a pain, pain in your hips and
Sciatica.
sciatica. Yes, this is just if we.
Yeah, sciatica.
Yes, you're right. Okay. Which condition do you associate inflammation in the stomach causing belly pain, indigestion, bloating, and nausea? Is it gastritis or
Gastritis.
colitis?
Straight ahead.
Yes, straight ahead. Right. So congratulations. So we found the center of the maze, and we just refreshed the meaning of some terms. Thank you. And if we go back slides like here, and so we need to yes, to have a look at this slide. There is information about the midterm test we are going to take now. Well, it's on the Moodle site. Let's just hope that it works now. We should check it. So this is the current week, and in the current week you can find this presentation, and you can also find that I'm going now to open this test for you, and you can find instructions to the test. The test will be open, accessible for about an hour. Let it be 2 hours. It means during this time you can start the test, and then you will see the time that is left till the end of the test. There you can see the time countdown, and you will have 50 minutes for this test. So, and the test covers the material of the units 1 and 2, and there are 35 questions and 4 types of questions. So there are, most of them are multiple choice questions. It means that you have to choose from 4 or 5 options. And then there are some true false questions. You are given the statement and you should decide if it is true or false. Then matching questions. For example, you are given some abbreviations, and for example, yes, you are given some abbreviations, and then you can see the definitions for these abbreviations, and you should choose from the list of definitions the correct option, and select missing words. You can see a short text with several gaps, and when you click on a gap in the menu, you'll see the possible options, and you choose one of the options which better suits this sentence. Well, at the end of the test, you should click on the save button. So You can move from one just question to another, and you can see on the diagram which is given on the screen how much questions you've answered. So the total amount of time is 50 minutes. You should do this in 50 minutes. So after this time, the test will shut down. And so it will also shut down if you start doing the test too late. So you should distribute your time. Now it's better to start the test exactly after the class now. Okay. So this is just some instructions, and I need some time to go to the Moodle site and open the test for you. Do you have any questions?
Yes, Doctor.
Doctor,